The second most common bone stress injury in the foot is a calcaneal bone stress injury, typically occurring in distance runners or military recruits. Outside of the large impact forces that running has, the eccentric pull of the Achilles tendon, which involves the gastrocnemius, soleus, and plantaris muscle, is a potential mechanism by which a calcaneal BSI might occur. Differential diagnosis involves other pathology such as Achilles tendonitis, plantar fasciitis, or retrocalcaneal bursitis. You can differentiate one by your location of symptoms. It's also helpful to recognize whether the symptoms are getting worse as you are continuing to run or improve as you run. With calcaneal BSI, typically your symptoms will get worse over the course of a run, whereas there'll be a warm-up effect with a Achilles tendinopathy or plantar fasciopathy type injury. Calcaneal bone stress injuries are typically treated conservatively. They are a low-risk site. They typically heal well with appropriate care. Having said that, I think where a lot of people go wrong is not respecting natural healing times. You can do everything right, but if you try and rush it, it's not going to go well. Generally speaking, you can take a two-phase approach to treatment, starting with restricted weight bearing and cessation of the inciting activity for up to 8 weeks until you are pain-free with weight bearing, pain-free with ambulation or walking. Phase 2 is simply a gradual reintroduction over the next 6 to 12 weeks of your sport. So that may take up to 3 months with a gradual reintroduction of your sport. Recurrence of a bone stress injury at the calcaneus can occur if somebody is going to return to their prior level of activity within 8 weeks, or if they're progressing while still feeling symptoms. That's not going to set yourself up for long-term success. That's going to set you up for a reoccurrence. Address it appropriately, and you should be able to get back to your prior level of running within a reasonable amount of time. Rarely immobilization or casts will be used for a bone injury at the calcaneus because it is a lower risk site. Having said that, in the event of higher pain levels, immobilization or non-weight bearing might be used for short periods.